And welcome everybody to our Be Well Talk today we're going to be discussing the importance of stretching and breath work. So lots of good information today that we'll be discussing in the next 30 minutes or 35 minutes or so. So the agenda or what we're going to be discussing are four kind of primary concepts here. So we're going to be talking about the anatomy of breathing. So we're going to be talking about various muscles that are important in the mechanism of breathing. We're going to be talking about why posture is important and how that affects our breathing as well. And thirdly, we're going to be talking about the mind and body connection. And then lastly, we're going to be going over the diaphragmatic breathing technique. So lots of fun things to learn for today. And also, I would make sure that there's some space around you so that you can comfortably move around because we are going to be going over a few demonstrations for our stretching exercises as well. So today, we're going to be talking about the anatomy of breathing. So when we're looking at the muscles, the organs, as well as the structures involved with breathing, when we inhale, air is taken in through our trachea or our windpipe, and it allows for our lungs to expand like a balloon, right? So when we're inhaling, we have a dome-shaped muscle just at the bottom of your rib cage called the diaphragm. And once that diaphragm contracts, it flattens to allow for the lungs to blow up like a balloon, like we described, for oxygen to go into our lungs and then subsequently be delivered by our blood cells to the various important organs in our body, as well as the important muscles in our body as well too. When we exhale or when we breathe out, the diaphragm relaxes and it goes back into its dome shape here. So when that happens, the lungs contract and it squeezes the air out of these balloons out through your windpipe and it's blown out through your mouth or your nose. Right. So the key concept here is that we need the chest wall as well as the rib cage, as well as the lungs and the diaphragm to open up to allow for air to go in. And then we breathe out. We need everything to contract in order to push the air out. So when we're looking at the various muscles that are involved here, so we talked about the diaphragm. So the diaphragm is the main muscle that contracts and relaxes to allow for air to fill in all the way to the base of our lungs. Now, we also have what we call accessory muscles that are involved in breathing in and breathing out, so inspiration and expiration. And those muscles are in between our rib cage. So we have what we call our intercostal muscles. So those of you who are meat eaters, if you ever had spare ribs, back ribs, that meat between the bones, those are actually your intercostals that you're consuming. So you can think about that the next time that you have barbecue ribs. And then we also have the muscles around our neck. We have the sternocleidomastoid muscle. So if you feel for your collarbone, which is that horizontal bone just at the base of your neck that runs all the way out to your shoulder, that is your clavicle. And then if you feel or palpate upwards towards the back of your ear, that's what we call the mastoid process. And the sternocleidomastoid muscle goes from your collarbone all the way up to behind your ear. So if you were to turn your head and rotate your head, so if you're trying to feel, let's say, your right sternocleidomastoid muscle, if you turn your head to the left and rotate and look past your left shoulder, that muscle, that ropey muscle that pops up underneath your finger, that's your sternocleidomastoid muscle. Okay. You also have your scalenes, which are the smaller muscles along the side of your neck that also help with elevating and lifting up the rib cage to allow for space for the lungs to expand. So in inspiration, or when you're breathing in addition to the diaphragm contracting, these muscles can also contract to allow for that rib cage to open up and expand, as well as lifting upwards to give space for the lungs to fill with air. Now, this can potentially become problematic where if you don't use, let's say, your diaphragm to breathe and you're what we call more shallow breathers, you're excessively using the sternocleidomastoid muscles as well as the scalene muscles. And that can become problematic because if those smaller muscles are overworking, then that can lead to things like neck tension. And because the insertion point, or where they attach right onto the base of the skull, that can also lead to things like migraines or perhaps tension headaches as well, right? So this is why breathing is important, because, or proper breathing mechanic is important, because if you're more of what we call like a shallow breather or an apical breather, then that can lead to other conditions such as migraines, headaches in relation to muscle tension, right? So if you're looking at expiration, it's pretty much a passive movement. And what that means is that when these muscles relax, it allows for that rib cage and that chest wall to return back to its normal resting position. And in that case, the rib cage begins to contract, and what happens is it pushes the air out through the lungs in order for us to exhale and push out the carbon dioxide. So when we breathe in, we want oxygen to be delivered to our organs, to our muscles, to our brain in order to function, and we want to breathe out and get rid of the waste product, which in our case is the carbon dioxide. Okay, so that's why it's important there. So we talked a little bit about issues with neck tension, perhaps migraines and tension headaches. A couple stretches that you can do if you do notice yourself that you're more of an apical breather or a shallow breather are to stretch these specific accessory muscles that we talked about. So this is a time where you can find a little bit of space, get comfy in your chair, and we're going to walk through a couple stretches for both the sternocleidomastoid muscle, or commonly called SCM muscle, as well as your scalene muscle as well too. Okay, so these are really good stretches, especially if you're noticing tightness and tension in the neck region, or if you also notice that you have headaches that are specifically worse after perhaps you've been sitting in front of a computer for a long time, or also if you've been driving for a long time, or just not in a great position, right? Or if you've noticed that you've been breathing more shallowly. So let's start off with first the sternocleidomastoid stretch. So in this case, I'm going to walk you through the stretches for the right side. Okay, so what you want to do first is to help with palpating or feeling the muscle. You want to use your left hand to feel around your collarbone region, just around the jugular area, so the front of your neck. So you should notice that if you feel your collarbone, if you move upward towards your head, it kind of or you falls into a little bit of a divot there, right? So that's the attachment point for one end of the sternocleidomastoid muscle. So what we're going to do is you're going to keep your shoulders down and relaxed, and you're going to tilt your head towards your left. So that's the first movement. Already what you should feel is perhaps if you have a tight sternocleidomastoid muscle, you should feel the muscle kind of pushing up against your finger if there's tension, right? So that's demonstrated by the diagram on my left. So we're tilting our left ear towards our left shoulder. Now, the second movement is to rotate to the right side. And you can kind of think about looking at the top right corner of the room that you're sitting in. So right up towards the ceiling. From there, you should feel more tension in this area and a nice stretch through behind the back of your ear, all the way down the side of your neck into your collarbone. And in this position, we're just going to hold it for about 30 seconds. And one thing I want you to keep in mind here is that you control how far you go into this position, right? So what you should feel with the stretch is a good amount of tension, perhaps a little bit of discomfort. But if you're feeling sharp pain, burning pain, you're probably going a little bit too far. Okay, so make sure that you're feeling a pull or a tension, not pain. And also something to think about too is focus on your breathing, right? So really try to slow down your breathing, try to keep those shoulders down. And you might even notice that with each exhale that you take, you may be able to rotate your head a little bit more, or perhaps tilt your ear down to your left shoulder a little farther. Okay, and let's slowly come up out of that stretch. And we're going to do the exact same thing, but now on the left side so we can even it out. So my right hand is going around my left collarbone. I'm tilting my right ear towards my right shoulder, and I'm looking up towards the left corner of the room towards the ceiling. And again, holding this position here, try to focus on your breathing, your exhale, keeping that left shoulder down, perhaps turning a little more on each exhale if you're able to, and making sure that you're feeling a stretch as opposed to pain. So typically with these exercises, you want to hold for about 30 seconds and you want to repeat the same amount of reps on each side just to even it out. And what you might even notice is that you may have one side that's tighter than the other. Typically, if it's your dominant side, that tends to be a little bit tighter. So for me, if I'm right-handed, I notice personally that my right sternocleidomastoid muscle was a little bit tighter compared to my left. Okay, so I'll invite you all to come back to your normal resting position. And we're going to go into our scaling stretch. So with the scaling stretch here, you'll notice that this diagram has 3 different positions, and that's because the scaling muscle has 3 parts. So there's the anterior, the middle, and the posterior, which are just basically fancy definitions or fancy terms for the front scaling, the middle scaling, and the back scaling. So based on how you're tilting your head, you may get the front, the middle, or the back. But let's start off with the back. So what we're going to do is we're going to go back to our right side here, and I'm going to get you all to sit on your right hand. So tuck that underneath your thigh or your bum. And this aims to keep your shoulder down so that you're not shrugging it up towards your ears. Okay. From there, you're going to tilt your head to the side and look down towards your armpit. So bring your nose towards your armpit like you're smelling your armpit. And from there, if you want an extra stretch, kind of like the diagram demonstrates there, you can place your hand on top of your head to pull down a little bit farther. So again, we're going to hold this position for about 30 seconds. And as you exhale, see if you can pull your head down a little bit farther. But again, making sure that you're just feeling tension and not pain. And slowly come up out of that stretch. We're going to do the same thing for the left side. So left hand goes underneath the thigh or behind your back. And we're going to tilt our right ear towards our right shoulder, turn your nose into your right armpit, hand on top of the head, and we're going to pull down. And in this case, now you should feel the stretch down the left side of your neck, perhaps even into your shoulder blades as well too. And again, focusing on your exhale as you breathe out, see if you can bring it down a little bit farther, but of course, not to the point of pain. Okay. And come up out of that slowly. And now we're going to target the middle scalenes. So in this case, we're not going to be rotating our head at all. You're going to bring your right hand underneath your right thigh, tilt your left ear to your left shoulder, and we're simply going to bring our left ear closer to our left shoulder. And this you should feel a little more along the side of the neck, whereas the first stretch you might have felt a little further towards the back of the neck. Making sure that your chin is tucked in so you're not poking your head up forward. And keeping that shoulder down as well too. So that's why it's important to sit on that right hand, and we're now going to switch. So left hand goes underneath the left thigh, keep that left shoulder down, looking straight ahead, keep that chin tucked in, hand on top of the head, and now you're going to pull your right ear towards your right shoulder. And this, you should feel a stretch along the left side of your neck. Okay, and slowly come up out of that there. And then the last stretch is very, very similar to your sternocleidomastoid stretch, actually. So starting on the right side, again, place that right hand underneath your thigh. We're going to rotate and look up towards the top right corner of the room. And you're going to place your hand on top of your head and you're going to pull down just slightly. And this one, you should feel a little more along the front side of your neck on the right side. You can also tilt your chin upwards a little bit too to get a little bit more of a stretch. So this is how it slightly differs from the sternocleidomastoid muscle stretch. And let's slowly come up out of that. Left hand underneath left thigh. Look up towards the top left corner of the room and tilt your chin out. And we're going to pull your head down towards your right shoulder, making sure you're staying rotated towards the left as if you're looking past your left shoulder. And again, you should feel this along the left side of your neck, but closer to the front of your neck. So this is how we can get all three fibers of the scalene muscles so that we can stretch from the front of the neck, the side of the neck, all the way to the back of the neck. So these are really nice stretches, especially if you're noticing quite a bit of neck tension, or perhaps, let's say you've woken up and you slept a little bit funny and there's a kink in your neck. This is something that you can also try to stretch it out to help with loosening up that muscle. Okay, so in terms of how often you should practice it, I would say about 3 to 4 times a day. Try to hold each stretch for about 30 seconds minimum. Okay, but again, 30 seconds is approximately, just approximate guideline. If at any point in time you're noticing lightheadedness, if you're noticing pain, if you're noticing any type of burning or anything along those lines, you can stop that stretch or perhaps just hold it for a shorter duration, or maybe not go that far into the stretch there. Okay, so now that we've talked a bit about the anatomy, the muscles that are important in breathing, let's talk a little bit about posture. All right, so probably prior to me mentioning posture, you all were kind of sitting in a nice relaxed position. And, oftentimes when people bring up posture, you kind of automatically try to sit up a little bit here. So the idea with good posture in regards to breathing is so that it allows for your lungs to expand fully. Right. So what I want you to try to do right now, so in your seat, I want you to sit in your poorest, most slouched posture as you can get into. Right. So I'm rounding my shoulders forward, I'm rounding my back, and I'm in this kind of slumped, slouched position here. Okay. So notice how your chest is slightly compressed, your rib cage is slightly compressed. So in this position here, I want you all to try to take as deep of a breath as possible. Okay. So you're going to take a nice deep breath in through your nose and out through your mouth. So notice how that's a little bit restricting, right? So if we were to try to get into good posture, I'll get you all to sit up nice and tall. Imagine there's a string on the top of your head and someone is pulling that string straight up, right? So your shoulders are back, your chest is out nice and proud, you're sitting up nice and tall. Now in this position here, let's try to take a nice deep breath. So in through your nose and out through your mouth. So notice the difference between the two positions, right? So hopefully you all notice that as you were sitting in that more upright position, that upright posture, or what we call, the quote unquote good posture, you were able to open and expand your chest better compared to if you were sitting in that slumped, slouched position, right? So that bad posture that we're talking about. So that's why if you have bad posture, subsequently it doesn't allow for the rib cage to expand, the diaphragm doesn't work as well as it should, and you rely more on those accessory muscles, so the sternocleidomastoid, the scalene muscles, to lift your rib cage upwards as opposed to expanding outwards. Okay, so with good posture, the second point here, it improves diaphragm function to allow, again, for the lower aspects of the lungs to get air in as opposed to just the upper aspects of the lungs. Okay, and because we're using the big muscle, the diaphragm, to expand the rib cage, we're not using as much of those accessory muscles, so it can help with reducing tension in and around the neck area as well too. And as you all noticed with the slouched posture compared to the good posture, if you are in your good posture, because you're able to expand that chest wall a little bit better, it can create the ability for you to breathe more deeply, which is good, which is great. And also, it helps with proper alignment and muscle balance. So if you're more in a kind of slumped over slouched position, it really closes up the space in the chest area, which creates tension in the chest. It can also lead to shoulder pain as well too, and especially for individuals who spend a lot of time perhaps in front of a computer or driving for long distances, that can become quite problematic, right? So the muscles in the front become quite tight. So that's what we call in the physiotherapy world upper cross syndrome, where the muscles in the back are really weak and the muscles in the front become really tight. So when we're looking at it from a treatment perspective, we have to work on strengthening the muscles in the back, which I'll show you all a couple exercises to help with that. And then also we need to stretch the muscles in the front as well. So with proper posture, we want to encourage the neck to be out of that forward head position, right? So the best exercise for that are what we call chin tucks. So what you see in this diagram here is this individual sitting up nice and tall. So for all of these exercises, you want to make sure you're sitting up or standing nice and tall, shoulders are down and back away from your ears. And the easiest way to cue yourself with the chin tucks is imagine, you can even place your two fingers on your chin. Imagine creating that double chin there. As you can see on the picture on the top, creating that double chin. If you're having a hard time kind of figuring out that position, you can also stand against the wall, or if your chair is high enough that it has a headrest, so perhaps if you're sitting in your car, try to push the back of your skull or the base of your skull into the wall or the headrest. Okay, so for these chin tuck exercises, you can hold this position here. So I'll invite you all to get into that double chin tuck position. Hold it for about 5 seconds, 4, 3, 2, 1, and then you can release. All right, so it's just a simple, small movement to help with bringing your head out of that forward head position, which creates a lot of tension around those accessory muscles. Now, we also talked about loosening up the muscles in the front of the chest. So inevitably, we're all, guilty of sitting in a slumped over position, which brings our shoulders in that forward rounded position. Now, the best stretch for that is what we call the pec stretch or the doorway stretch. So those of you who have access to kind of like a door frame or a space, you can walk over and use the door frame. Otherwise, if you're not close to a door, you can also do this in sitting as well. So in the sitting position, you can place your hands behind your head as if you're lounging on a lounge chair by the beach. And what you're going to do is sit up nice and tall, and you're going to bring your elbows out and stick your chest out as far as you can without overextending and arching your back. So what you should feel here is a nice stretch through the front of your chest, and you should be able to even feel that you're able to inhale and expand your chest a little bit better. So in this position here, you can hold it for about 3 breaths. And again, you should feel a nice stretch through the front aspect of the chest and even into your shoulder as well too. But if you're doing this stretch against the doorway to get a bigger stretch, you can lean forward so that it brings your arm back further. And that way you can create a little bit more tension to loosen up those pec muscles there. Okay, so for the stretch, you can either time it for 3 breaths, or you can hold it for about, again, 30 to 45 seconds. So now kind of moving on to the topic of the mind and body connection. Breathing is a very important aspect of our bodily functions, of course, right? But if we compare it to other aspects or other mechanisms in our body or other organs in our body, breathing is one of which we are both conscious and unconscious of. So when you're sleeping, you're still breathing, right? But you don't have to actively think about it. But you can also control your breathing in the sense that you can consciously hold your breath. You can consciously increase your breathing rate, but you can also consciously decrease your breathing rate. Now, how this ties into our nervous system is that we have two sections of our nervous system. We have our sympathetic nervous system, which is our fight or flight. So if you're walking down the street and someone jumps out at you, right, the response or the physiological response in your body is that your heart rate goes up, your blood pressure goes up, your breathing rate goes up, but your digestive functions go down. Now, this is important. Previously, when we were, predator and prey to help with survival. But, in nowadays society, it's not very conducive on a regular day-to-day basis, right? For the most part. We also have what we call the parasympathetic nervous system, which is the opposite, right? So we have the rest and digest functions where heart rate is lower, blood pressure is lower, breathing rate is lower, and digestion goes up, right? So which is why we call it the rest and digest. Now, when we're in this stress state, right? So looking at individuals who are receiving their cancer diagnosis, they're going through their treatment, they're recovering from surgery. Oftentimes, our bodies are in that sympathetic state, that stress state, and subsequently, we unconsciously tend to also breathe at a higher pace as well, too. When we do breathe at a higher rate, as opposed to taking a nice deep breath to allow for our lungs to expand, even at the lower lobes, we tend to be more apical breathers, right? So we talked about earlier on why that can become problematic because we're utilizing more of the accessory muscles and we're not breathing in to allow for our lungs to expand fully. And we know that the more air that goes into our lungs, the more oxygen that is delivered to the vital organs in our body, our muscles, our brain, our heart, right? Our other organs that are important as well too. So that's why if we were to work on, let's say, meditative practices or relaxation practices to decrease our breathing rate, that can also trigger or stimulate our parasympathetic system to allow our body to rest and recover. So with that being said, let's talk a little bit about breathing mechanics or diaphragmatic breathing mechanics. So I'll invite you all to get into a nice comfortable position here. Make sure that you're sitting with your back fully supported. So if you're sitting on a chair with a backrest, you can lean back into that. Relax your shoulders, your chest, arms face up on your legs. And if you're standing, you can turn your palms outwards. Okay, now to cue your diaphragm, you can place your hand on your abdomen or your belly, just over your belly button, and you can give a little cough here. So if you're coughing, you should feel that diaphragm muscle pushing out into the palm of your hand. And this is the cueing that you can use for that. So for diaphragmatic breathing, the concept of that or the timing of it is that you want to inhale for a shorter period of time or half the amount of time that you're exhaling. So let's say if you're breathing in through your nose for 4 seconds, you want to make sure that you're exhaling for 8. If you're breathing in for 3 seconds, you want to make sure you're exhaling for 6. So how you can control a slower exhale is you can purse your lips as if you're blowing out a candle to allow for slower release of the air out of your lungs. Okay, so again, getting into that nice comfortable position, hand on the front of your belly. You're going to take a nice deep breath in through your nose for 4 seconds and make sure that your shoulders are staying nice and relaxed and you're feeling your hand push out forward. Okay, so let's do that together. Breathe in through your nose, 4, 3, 2, 1. Now hold that for 3 seconds, maintain that lung expansion. And exhale through your mouth slowly for an 8-second count. 7, 6, 5, 4, 3, 2, and 1. So what some of you may have noticed is that you probably finished your exhale and finished breathing out perhaps even before the 8 seconds. So what I want you to think about this next breath is to slow or decrease that rate in which that you're breathing out. If you feel like, by 6 or 7 seconds, you're already finished with your exhale, try to manage that pace a little bit better. And the idea is that we want to maintain that expansion in your lungs and create a slower release to allow for time for that gas exchange to happen. So that gas exchange is we want oxygen to be taken into our body, and we want to allow for carbon dioxide to be expelled out. Okay, so let's try that again. So breathe in through your nose for 4, 3, 2, 1. Really feel that abdomen expand. Hold that for 3 seconds, 2, 1, and slow exhale through your mouth. Purse lips. 8, 7, 6, 5, 4, 3, 2, and 1. Okay, so what you should notice is that the second breath might have been a little bit better in terms of timing compared to the first breath. But if you really think about it, diaphragmatic breathing is an exercise because the diaphragm is a muscle, similar to, push-ups and squats and bicep curls. It really does take practice in order to build up that strength and coordination in the muscle. So the more you practice, the better it'll be. Right. So the idea is that you want to practice these deep breathing exercises, these stretches, these postural exercises about 2 to 4 times per day in order to see the benefits. Now, Rome wasn't built in a day, and you want to make sure that you're, giving yourself a little bit of grace and listening to your body and allowing for yourself to make these slow progresses. It's not going to improve in a day. It's not going to improve in a week, perhaps. But what you should notice is that over time, your breathing pattern's a little bit better. If you had neck tension, that should be slowly a little bit better, and amongst other benefits as well, too. Okay, so again, practice doesn't make perfect, but it does make progress. So just like any other exercise, just like, you brush your teeth every day, you want to make sure that you're also practicing these exercises every day in order for you to maintain consistency, in order to, again, reap the benefits of the breathing exercises as well as posture.